Hello everybody, good evening. I'm just going to add Ellen to the live. Thanks for joining. Let's see if Ellen gets this invite. Thanks people for today. Try again. Oh, I did mean Ellen. Hopefully Ellen will be with us soon. Okay, I'm just trying to invite her again. Guys, I don't seem to be getting Ellen to join us at the moment. Just waiting for her. Ellen, if you are not getting the prompts, do a request to join just from being in the live. Can you do that? Okay. Ellen, if you could. Aha, I think she's joining now. Fingers crossed. So coming online. Oh, maybe it didn't work. Oh, let me try again. Try and accept again, Ellen.
Oh, it's good job you know what you're doing.
There you go. Hello.
Well done. Hello.
Hello, how are you?
I'm all right, thank you. You?
I'm very well. I'm very well. I'm glad that finally worked out.
Well done. Have patience.
Well, anyway, thanks for being here. Thanks everyone who's online with us tonight. Just to give you a little bit of an overview of what this is, we are doing a series of Instagram live conversations with a selection of our speakers that are going to be speaking at our annual conference in May. And Ellen is one of those. We have already had a conversation with Erin Bellamy, which, by the way, is why the title is slightly confused. It should say Ellen Calteau, and we've talked to her about her plans for what she's going to be talking about at the conference and what she's most looking forward to, and that is what we will be asking Ellen tonight. But before we get into any of that, I'm just going to do a little bit of an introduction to the public health collaboration. I think everyone already on is probably very aware of us, but in case anyone isn't, we are a UK-based charity that is all about helping people understand the power of their own metabolic health, both the public and healthcare professionals, and to inspire and educate people towards managing that to have a chronic illness-free life. That's what we're all about. And we have our annual conference coming up in May, and we're all very excited about that. So we hope that having these conversations will help others get a little bit more excited if they're not already very excited about what we're going to be talking about, who's going to be coming along, and some of the projects that we already have underway. We are a charity that is very much a grassroots charity that relies on support of individuals out there to help us along. We don't take any industry funding, and so it is very important for us to get everybody's support and to use our conference as a moment in the year where we can bring everyone together who's trying to help this movement go forward. So we're really excited about all of that, and I'll explain a little bit more about the projects as we kind of continue through tonight. But one of the key projects that we do as a charity, and similar to all of the projects that we do, is to actually not just help people understand the importance of metabolic health, but to actually make changes to the system that we all want to see happening at different points and different entry points into the system, the education system, the healthcare system. And one of the projects that we have underway is called Liberate, which is a project to start piloting how we can better manage people who have a food addiction. So that is why we have invited Ellen on tonight to talk about that, and that's what she will also be touching on at the conference. But before we get into that project, I'd like to just start with you all getting to know Ellen, because she has a fantastic story to share, which I don't think gets shared anywhere near enough as it should be. So I'd really like Ellen to give us the benefit of her journey, and we can ask her questions as we go. If anyone does have any questions, if you could pop it into the little speech bubble that has a question mark in it, that would be a lot easier for us to pull them out. So feel free to ask as we go. And yeah, Ellen, we'll kick off with you. Tell us a little bit about your journey into this world of nutrition and how you got here.
Oh, thank you, Olivia. Well, this is my first Instagram live. Wow, isn't this interesting? Very exciting. And you're right, my story doesn't get shared a lot, and that's because I was ashamed of it for many years. So it wasn't until last year, last March actually, that Dr. Jen Unwin convinced me to start talking about it, and it's helped me grow quite a lot, and it's helped a lot of people. So trying to get more comfortable with it. So I guess my story kind of goes back to when I was a baby, early 80s baby, and I had multiple allergies, and they were very severe. I was in and out of hospital. I had very young parents who try to understand, how to manage somebody with allergies in the 80s, where you had grandparents where they go, that just doesn't exist. Just give it to her anyway. And the way my dad recounts the tale of the consultant saying to them that he gave a list of all the allergies, and they said, just don't have anything with this in it. And my dad says my mum and dad went round like the supermarket for hours looking at the packets of foods and things like that. And he said he came out with 200 fags. That's because there was nothing there in packaging that they could give us. Luckily, they knew how to cook. So for the first 7 years of my life, I had a real foods diet. Everything was cooked from scratch. It was meat, fish, vegetables, fruit. And I was a healthy weight. I was a healthy size. I grew well. Didn't have any problem with allergies. My sister came 3 years after me, and when you look at photos, there's a very big difference. She didn't have any allergies, and so she could eat anything. Well, anyway, going up to about the age of 7, the food industry changed, and we stopped just having all nut oils called vegetable oil, and we singled them out to sunflower oil, rapeseed oil. So all of a sudden, all of these colourful packagings were now available to me, and I could eat them. And I caught right up. And you can see it in photos. As a child, that within a year, I'd gained an awful lot of weight. I still couldn't eat cake, so I'd never had a cake until I was late 20s, I think. But there was loads of other things that I could suddenly start having, and with every year I gained a stone. Doctors were quite concerned with my weight. It caused problems with my hips, so I had to have plates and pins put into my hips so that I could walk. Obviously got a load of bullying, all of that stuff that comes with it, and the not being able to get friends or boyfriends and things like that. By the time I left school, I was 16 stone. I'm only 5 foot. So that at one point, I think the biggest I got to, where I just stopped weighing, I was 20 stone, which is a BMI of 55, and they were considering bariatric surgery. I'd been in and out of doctors' offices, dietitians' offices as a kid and as a young adult. Always given the same advice, which was brilliant. I loved it. It was have low fat. It was fabulous. So I could get all these yogurts and put jam in them. And I could have jam on toast. It was brilliant. I was like, this is fabulous. But you always got the impression, in fact, sometimes we were actually told, well, she's getting the food from somewhere. So she's not following it. She's getting it from somewhere. I dare say I was stealing it. But my parents, they followed what they were told, and they did low fat. But I kept gaining weight. I did your usual commercial weight loss groups, and I did. I remember one where they said on these certain days, you can, as long as you cut the chips the way they say you to cook them, you can have as many as you like. At this point, I didn't realise I was a food addict. I didn't have a clue. Spoiler alert, I'm a food addict. So I went home and I cooked 3 baking trays, and I didn't leave space between these chips. I had 3 baking trays worth of these chips, and then my meals. And I went back a week later, spent my £5 to be told I gained weight, and I was baffled. You said that was okay. I did learn about low carbohydrate. And this would have been my very early 20s. I learned about low carbohydrate, and I did that. And it was the first time that I tried it. I lost about 6 stone, which was great. But I got scared off the diet, if you like, or that way of living by well-meaning people and healthcare professionals. At the time, they were saying, oh, this is going to be dangerous for you, or things like you shouldn't feel deprived, don't feel left out. I didn't feel deprived, but what happened was, as soon as I started to reintroduce all of processed foods now, I just couldn't stop. I was never assessed for an eating disorder ever. It was always another 12 weeks to commercial weight loss group or bariatric surgery referral. So once I'd started again, I knew that low carb was going to work, but for some reason there was something missing, and I couldn't get back onto it and stay on it. There was lots of talk about moderation. I just simply couldn't. I left the country in the end. Thought maybe if I just change everything, get rid of everybody that's around me, it's all their fault, just go. But the thing is, I went with me, and it just didn't help. There were shops in other countries as well, and that didn't help. I started losing friends because I was eating so much. I wasn't going out. I was just isolating myself. I was not doing my jobs properly. At one point, I lost a job, and that's because I was eating so much. At this point, I was quite depressed now as well. I was aware that I was waking up, and before even opening my eyes, I want breakfast. And as I'm daydreaming, as eating breakfast, I'm either thinking about trying not to eat until lunch, or what am I going to eat at lunch? You know, depending on the kind of day that I had. And maybe I'd have a good day, but then by the evening it would be me in my bedroom with the radio on, so as to fool everybody in the house that, you know, because I'd just eaten a salad in front of everybody, and then go to my bedroom and it would be crisps and chocolate, crisps and chocolate, crisps and chocolate, with the radio on loud so nobody would hear the wrappers. And then just in fits of tears with the determination tomorrow will be different. And then something happens the next morning. It's just all forgotten, just forgotten. When I realised that I wasn't quite normal with food, when the way that I behave with food in offices, I would rearrange the biscuit tin so that nobody would know that I've taken some, or I'd stay late so that as soon as everybody could go, I could then eat it. I can't tell you how many Easter eggs I've replaced, and advent calendars, stealing of food, the hiding, the stealing money for food, the hiding it just to be able to get it. And then, of course, once you're so full, you've got to be able to get it out. And once I was so depressed at one point, suicidal, I remember just getting laxatives. And it wasn't because I wanted to lose weight. At this point, I didn't care. I just wanted to be gone. But I needed to get that food out because I was so full. But I needed to get that out so I could put more in. Which all sounds really, really depressing. It does. And it was awful. It was an absolutely awful way to live, to be constantly bombarded with food thoughts with your every waking hour, and sometimes even dreaming about it. So it just consumes you. Nothing else is important. So then I knew that low carb worked for me. It had worked before, but I really struggled to get back on it, and until I learned about food addiction and met other fellow food addicts, and they got me through it. And I can't tell you how bad the withdrawal was. Oh my gosh, because I went like cold turkey. And I remember clock watching, pacing the floor, because it was set at 3 meals a day. Whereas I'm used to 1 meal a day, and it started at 8 in the morning, it finished at 10 o'clock at night. So it was just bizarre. And I was clock watching. When is I've had my breakfast now. Is it time? Oh, it's only been 10 minutes. And it was horrible. I was in a very fortunate position at that point. At the very beginning, I slept between meals. My working hours were morning and evening, so I slept between meals, which was helpful. I remember having the sweats. I remember having stomach problems, being irritable, crying, feeling sick, and the scream from up here, the scream to just go to the shop and get more. I was so angry at these people that were trying to help me as well, because it's all part of the withdrawal. But they did. They helped me. I phoned them several times a day just to stay on the wagon, as it were. And in about 3 weeks' time, just over about 3 weeks, the fog lifted. Everything seemed brighter. And then it was just the psychological talk of, well, you've been really good. You can have one. And then, no, I'm not going to. It's going to be okay. I remember dreaming about food as well. I haven't had chocolate. It will be 14 years on Monday since I last had chocolate. Wow. And and I remember even years later still dreaming about chocolate, waking up going, oh my God, where did that come from? Chocolate was my main thing, by the way. So over 2 years, I lost 11 stone. and I've kept it off since then. So 14 years. I've managed to keep it off. After I'd lost that weight, I came back to England and I went to my GP and said, you know, people need this kind of help. Maybe we should have a different approach. Can we start a group and help the people in our local area? And they said, oh no, we can only listen to dietitians and only take their advice. I came from a hospitality background, so not a medical background or anything like that. So I had to get myself back to school. I was determined to help people because I felt that you know, some people they're not managing these commercial weight loss groups and they need additional help and support. So yeah, I went and got my GCSEs finally. Parents were finally proud. Yay! I got my GCSEs. Then I got my they've always been proud. Then I got my A levels, and then I did my undergraduate for dietetics and started working in the NHS. But it then turned out that food addiction didn't exist. So I was quite shocked. I was like, oh, okay. Right, this is interesting. And I kept getting this same sort of thing, well, we need more evidence. So I was in a really lucky position and managed to get a PhD training, which is what Liberate's now based on, to be able to provide some more evidence for food addiction for here, mainly in the UK, because there's not a lot of talk about it in the research arenas about food addiction in the UK. So my research is based on that now. Yeah. Yeah, I wrote a course to be able to support people in groups. So working in groups is really important. Addiction is incredibly isolating. So it's bringing us back to community, and that course now is where it's in the PhD, which we've called Liberate. Yeah.
That's amazing. Thank you. It's interesting how many people in this line of work have come from their own personal story that is almost a replica of what they are now trying to solve, and it obviously turns people into you know, to kind of have a drive to go and try and help people. Was there anything in particular that made you want to do that? Like, how would you identify that moment where you thought, well, I've solved my own issues and now I need to, is it kind of pay it forward, or is it that you want to be part of the solution, or what do you think's behind that, and how would you describe that feeling?
I think I mentioned I have a sister and my dad's, so there was no dodging this bullet of addiction. My family, it's in all my one way or another. My dad and my sister both ended up choosing the bariatric surgery route, and they've had a lot of complications since, and it just made me so sad that they were still getting the same advice that we've been getting for decades before, and it wasn't working then. Why all of a sudden will it start to work now if they're not receptive? But there are people out there that were receptive and started to help them. I could see, oh, this is working on a one-to-one basis. I guess there's a fine line between stubbornness and determination, and I can be quite stubborn and push it to determination and go, right, I want to be able to help people here, and that's why I approached my GP. I'd have happily done it in the GP surgery as a volunteer, like our ambassadors, but yeah, I've had to go this way, which is fine. It's made a career of it. It's lovely. The amount of people we're helping now. So I would say it was that time when I came back to England, and my dad and my sister were still being given the same advice.
Yeah. Okay. I mean, that's obviously a very powerful driving force, is your own family and seeing others that are vulnerable to what you were vulnerable to, and wanting to fix the system for them is probably another angle on it. That's very powerful for people.
Absolutely. At least giving people another choice, letting people know there is another way, rather than just this is the only way, now go do it.
Yeah.
And if it's food addiction and it's affecting the brain, we need something more than just a diet. We need that mental health support.
Absolutely. And it's amazing what you're doing, which is really pioneering research in the UK, which we don't have very much of, if anything, at the moment. And I think the figure is 14% prevalence in adults at a non-UK cross-section, I think, of 36 countries. Do you have any sense of what the level is in the UK? Because we also have higher levels of childhood obesity and or of obesity, and I just wondered if you have a feel for whether you think if we were to do that survey in the UK, we would be just as bad or even worse than some of the averages that we've been hearing about.
I guess because I see it every day, I'd be thinking it's even worse. But I reckon, I mean, because thinking about where those figures came from, they've come from quite similar countries. I reckon we'd be on par.
Mm-hmm.
Yeah.
Excellent. And you mentioned
it's the future I worry about. It's the future. I mean, because we've got that study. We've got 12% of children that have got food addiction symptoms. What we don't know is, will they grow out of it, or will they grow into more?
Yeah.
That will be interesting to see.
Yeah, absolutely. You mentioned there that you've designed this course as part of your PhD, and that it is a key component is having community support as a success criteria. And is there anything else that you think is different about this course that people may not appreciate, that could actually do something maybe different to other food addiction courses, or certainly different to the kind of the standard way of kind of going through a weight loss program? What is significant about it that is different?
We don't go on about the food. We talk about the food. We put the diet on the lifestyle way of a way of eating, so low carbohydrate at the beginning, but then we give people the education of why we're suggesting that they eat that way. So and why ultra processed foods and what they're doing to the brain. So actually go into that sort of science. For some people, that's enough to go, okay, at least I can now relinquish that blame that I've carried for so many years. It isn't my fault, just not wired quite correctly, and nobody else can see it because it's in my brain. And the feeling of being different for such a long time is then explained. That helps them, and then they can start processing that and working with it. You wouldn't get that in standard care. It would just be the diet and that sort of thing. Yeah.
And you said yourself that you encountered, very different views as to whether food addiction was even a thing. And are you finding that as you're putting people through this course, that they are able to actually take on this idea of food addiction, and it makes sense to them as to what they have been dealing with all of this time? Is that something that other people are realizing quite easily as they're going through this?
Yeah, many people have just felt relieved. They knew that they were addicted, but they didn't realize that it could be treated in the same manner as alcoholism or drug use. So once they've learnt that, they go, okay, I can take this a little bit more seriously now, rather than the sort of office banter of, I'm so addicted, I've had 3 biscuits. Wow, that's one side of my mouth, that is. So so people will be feeling, oh wow, I'm really bad then, so now they hopefully will be able to confidently be able to say no to some of these things with a reason, and hopefully be taken a bit more seriously.
Yeah, absolutely. Which is why it's so important to do this pilot, and so that we can get the learnings and have this type of support for many more people. And just moving on to the conference, Ellen, what in particular, what you've just said or what you're planning to talk about, do you really want to make sure people hear? So this is your chance to kind of highlight that, so everyone's got their ears pricked up for the key messages you want to make sure land.
Support people with you don't know who has a food addiction. I guess if I could get people to just not even offer ultra processed food to others, and maybe our audience is already doing that anyhow, but it's for a food addict, some of them, they've never said no to these foods, and they haven't learned how to do them. That's what we do through Liberate, is we teach them how to say no, and they practice saying no. So don't put them in that position. Just don't offer these sorts of foods to people. That would be a great message just for, especially kids. Let parents be in control of the amount of ultra processed foods that kids have. I'm really looking forward to sharing the results. We haven't had them in yet. We just finished. Last night was the last of the 6 weeks. So they'll be being filled in now. But the feedback we've had so far, the retention rate has been amazing. Feedback has been along the lines of they're now in the non-diabetic range for their blood glucose. Their mental health has improved. They are have less social anxiety. They feel more confident in being able to go to the shops. I mean, imagine an alcoholic going into recovery and then having to go down the alcohol aisle all the time. Food addicts are bombarded with it wherever they go. So having people say to me, like yesterday, I went past the Easter eggs and just went, nah. Whereas before, it's heart stopping, it's breathtaking. Oh, they're here again. They're here again. It's same time every October. Every October, Christmas is here, isn't it? It's before Halloween, and I walk into the supermarket. So, oh, there's the mince pies. Here we go again. I've had a few months where I haven't had to think about it, and there they are. Okay, let's go through this process again. Yeah. And they go from that to. I mean, not in 6 weeks, it takes time, but you go from that to, I mean, the last 2 years, I haven't even realised it's been Pancake Day. It hasn't even crossed my mind. Whereas it had been in my calendar, I'd have bought all the ingredients and eaten them a week before Pancake Day, and then had to go out and get them again. So not having your life ruled by food, that's brilliant. Life in between food, yeah. That's just worth doing it just for that. Just listening to say things like that. It's brilliant.
And it's ironic because there is such a counter argument that is prevalent as well, where people say, well, by restricting someone's food choice, you are actually making sure that they do develop some kind of food disorder, some eating disorders, and or you could maintain an eating disorder. So what do you think about that? Because it does kind of fly in the face of what we're trying to do and what we believe to be right as far as how to deal with food addiction.
Yeah. So Erin and myself, I think Jen is on that team as well. Ali Houston. There's a few people. What we've actually started having a look at the research to see where this has come from, and we can't find a source of where this has come from. So we'd like to understand that better as well, because it just seems like it's something someone has said and then repeated and repeated until it's become gospel. So it'd be interesting because we have measured binge eating to be able to see if we can put shed some light on this area as well. So we'll see when we get those results come through as well.
That will be interesting. And so that's what your contribution to the conference is going to be around. Have you had a chance to look at our schedule for the rest of the conference, and how are you feeling about the rest? Are there any particular talks or speakers that you are really looking forward to hearing?
Absolutely, there's quite a few. We've got a countdown calendar for it. I'm looking forward to seeing Ben Bittman again. He was great last year, and Jane Buxton, I really like her, so I'm looking forward to seeing them. It'd be really nice to meet Anthony Chafee, because he couldn't make it last year, so I'm glad he's coming over this year. And Ken Berry, quite like his work as well. I'm really looking forward to the panel I'm on. It's the next generation. I'm looking forward to hearing about that. It's really interesting that we're right outside one of the big food corporations' headquarters. Don't know if we're allowed to say it. So it'd be
there anymore, though.
Oh, have they moved? Yeah. Oh, that's a shame. Did we scare them off? Probably not.
I think they must have known we were coming. Yeah. Okay.
So I'm looking forward to that, and I mean, as much as I enjoy what I do, it as a mum, it concerns me for our next generation, and if we're at an 80% ultra processed diet now for most kids, are we shortly going to be at 100? Who knows?
Yeah.
And what's the fallout going to be of that? Am I going to be in a job for life? Who knows? We'll see. Yeah.
And we have actually got Eddie Abu as well involved in that conversation, and obviously that is going to be an interesting mix because of how he is able to cut through to that younger generation at the moment and really starting to change people's mindset, change the culture, and that's really the kind of the level of change that we need, and we need it as soon as possible. So him facilitating that and accelerating that is just fantastic for everyone in the space that's trying to get these messages through. So yeah, and I think there's so many other great speakers. So if anyone wants to have a look at our lineup, have a look at our conference page. There's some great ones on there. I think Gary Taubes as well, and obviously David Ullman, Dave Feldman talking about cholesterol, and also the Ben Bickman, Anthony Chafee one that you mentioned is a discussion about whether or not red meat reduces your lifespan. So we actually have 2 debates this year. Last year we had one debate about whether or not we need to eat plants, and that did go down very well. Lots of people found that very informative, and what we will be doing this year is actually using that similar format, but picking up different questions. So one question that's going to be using that format will be, does cholesterol cause heart disease? And that's the one that Dave Feldman is involved in, and there will be other speakers that will be opposing that the different viewpoint that he would bring to the table. And the other debate is the red meat one. So does red meat shorten lifespan? Again, Anthony and Ben talking about that. And Ben is planning to really go into the longevity side of the science of the longevity side, which is not something he's spoken about before. So that's going to be interesting and exciting to get Ben's angle on longevity. And also there'll be some opposing speakers that do believe that red meat does shorten lifespan. So it will be great to see, again, different ideas that we hear out there being contrasted together and hearing the evidence for each side so that people can make up their own minds. So yeah, we're so excited about our lineup. We're just chomping at the bit to get on to it all happening in just about 8 weeks time or so now. So I have kind of a final question for you, Ellen. You were actually part of the public health collaboration as our food addiction specialist. But if you were to kind of step away from your role within it, what do you see as the kind of the function of an entity like PHC in the wider scheme of all the change that needs to make? What do you think we need to be doing alongside all of the rest of people in this space?
What I like about the PHC, and maybe want to become a trustee to begin with, is how they're reaching out to people and they're not even asking for anything. They just want to be able to help people and let them know there is another way. Just thinking about Liz's, I've forgotten Liz's surname, so sorry, Liz, but whatever, our LaPlante, of course. She helps manage the ambassadors, and which they're all over the country, all of them just doing it because they're passionate about it, and to the point that they've recorded a course and it is there on YouTube for you to just learn completely for free, to understand everything and start this journey. If I had had that as a resource when I came into this, that would have been amazing, because your symptoms, your food addiction symptoms, go straight down when you go low carbohydrate, because that rules out the majority of the ultra processed foods. But not only is it just a course and then off you go, no, she offers, I think it's weekly support. So you actually can go there and ask questions. They don't ask you for anything. And I like that. I like that. You try and do that in the NHS. Yeah.
Yeah, and that's a good point. I mean, there is so much free resource that the PHC does give out to make sure that everyone has the chance to take control of their metabolic health, like you just mentioned, that free course. We also have a website that's packed with resources. It has all of Dr. Unwin's sugar infographics and many other studies and excellent pieces of content that really help you understand this kind of space and how to eat. We also have a YouTube channel which has got fantastic catalogue of previous conference talks that go back many years, because this is our 8th conference this year. So we have accumulated quite a stockpile of fantastic talks by people like Tim Noakes and Jason Fung and Robert Lustig, and our plants debate from last year is particularly popular at the moment, and all of that again is for free. So whilst our conference is obviously chargeable, all the proceeds from that, as I mentioned, go towards all of these programs that we're doing, like Liberate, like the Lifestyle Club, which is helping to reverse people's type 2 diabetes with the NHS, and also we have a program to help change the education provided in schools for the younger generation to understand UPS really early. So these are really important programs that we think is going to change the system as we know it. It's not just about providing information, it is about changing it from the bottom up. And so anything that people can do to support us is going to be extremely well used and appreciated. But our YouTube channel is absolutely free for people who can't come to the conference. They can always catch up on everything that's been talked about at the conference on our YouTube channel. It won't be immediately, but it will be there at some point, and then everyone can enjoy it there as well. So pretty much everything that we try and provide for people, we're doing it in a way which can make it as accessible as possible for as many people as possible. So yeah, that's generally our philosophy, I think, at Public Health Collaboration. So I think that is all we wanted to chat about tonight. It's been a great conversation, Ellen. I don't know if there's anything you want to add as a final thought before I wrap up.
Well, thank you to you and everybody that's listened. It made my first Instagram live lovely. I could see the hearts, which is a nice bit of a confidence boost. So thank you very much for that.
Lots and lots of hearts to you and your amazing story. Thank you for sharing it and being vulnerable enough to do that for other people's benefit. So thank you for your time. And for anyone who is thinking about coming to our conference, we have today released our live stream ticket. So if you can't make it along in person, that's always the preferred option, and you won't regret it. It really leaves everyone on such a high coming along and meeting the community and being part of the vibe. It's such an energetic vibe. So please try and come along if you can. But if you can't, then today we have released live stream tickets to allow people to still be there as those exciting debates are unfolding and seeing all of the action without missing it or having to wait for it. And so you just need to go to our website, phcuk.org/conference, and that's where you can see the whole lineup, see the schedule, and book both in-person and live stream tickets. So hopefully people will be interested in doing that as a result of this conversation tonight. And if you're already booked, then we'll be seeing you there, and also seeing you on a few more of these live streams coming up. So keep an eye out, and you'll be able to hear a little bit from a few different speakers before the big day arrives. So that's all I wanted to cover as final thought. And Ellen, thank you so much for your time tonight. Thank you to everyone who's joined us, and we'll see you on the next Instagram Live.
Thank you.
Thanks everyone.